Ladies and gentlemen, please welcome ANCC's Vice President for the Magnet Recognition and Pathway to Excellence programs, Rebecca Greystone.
Hello and welcome everyone to the ANCC National Awards virtual event. We are so excited to come together and honor the two major award categories. First, we will honor organizational excellence with the Magnet Prize and Pathway Awards graciously sponsored by Cerner. Then we will celebrate the achievements of individual nurses with the ANCC National Magnet Nurse of the Year Awards and our newest honors, the Pathway to Excellence Nurse of the Year Awards. As you know, we rescheduled our 2020 live conferences to 2021, and we didn't want to wait 1 minute longer to recognize these extraordinary nurses and healthcare organizations. We are thrilled to present these well-deserved recognitions, celebrate our award winners, and give them their time in the spotlight. Of course, we wish we could be celebrating with all of you in person, but we're excited to showcase our 2020 award winners virtually. We selected today on purpose. It's the second week of National Nurses Month, and our theme this week is recognition. This year, the American Nurses Credentialing Center celebrates 30 years of recognizing and supporting nurses and nursing excellence. There certainly is no better time than now to reaffirm our critical position as strong and equal partners in healthcare delivery. To all the nurses, your families, supporters, and friends who have joined us today, I say once again, thank you for your courage, the dedication, teamwork, and above all, the compassion and human connection you show your patients every day. Now it's my pleasure to introduce Dr. Rhonda Anderson, President of the ANCC Board of Directors. Dr. Anderson will tell us more about our organizational awards, the ANCC Magnet Prize, and the ANCC Pathway Award sponsored by Cerner.
Thank you, Rebecca, and welcome everyone. My thanks to the ANCC board members who give up their time and their talent to lead the organization to excellence in credentialing. On behalf of the board, I'm honored and very proud to present these awards today. The board established the ANCC Magnet Prize to recognize exemplary programs in magnet-recognized organizations that transform healthcare delivery and improve patient outcomes. The winner of the 2020 ANCC Magnet Prize will be announced today and will spend the next 6 months further developing their innovative program. They'll return to present their outcomes at the Magnet and Pathway co-located conference this November. The ANCC Pathway Award supports the efforts of pathway designated organizations to promote the use of state-of-the-art technology in the practice setting. The award honors an initiative that demonstrates innovation in the use of technology to create a positive practice environment. Our 2020 Pathway Award winner has spent this last year developing their project and will present results of their winning innovation later in today's program. I'm very pleased to announce that our exclusive, generous sponsors, Cerner Corporation, doubled their support of these awards in 2020. The ANCC Magnet Prize has increased to $75,000, and the ANCC Pathway has increased to $50,000. On behalf of everyone at ANCC, we are extremely grateful to Cerner for its additional investment, which will help us continue to support nurses in their never-ending pursuit of excellence. It is now my honor and my pleasure to introduce Dr. Eva Karp. She is Senior Vice President, Chief Clinical and Patient Safety Officer at Cerner. And she will introduce our first award winners.
It is my great pleasure and privilege to welcome you today. While I wish I was providing this message in person, I'm immensely honored to represent Cerner supporting this great cause. As a fellow nurse, I've never been prouder of the great work of nurses around the world as they battled COVID from the front line. It's been so special to watch our community rise to the occasion and lead with compassion. You are trusted advocates, facilitating the physically demanding and emotionally taxing work of patient care and safety. At Cerner, we understand nurses and the challenges you face because many of us are nurses. We are proud to have over 700 nurses on our team working across the company in leadership roles alongside our clients in product innovation. The experience I gained as an ICU nurse years ago still informs my influences my work at Cerner. As a co-chair of the Cerner COVID-19 Task Force and a leader of a community partnership to facilitate a high-throughput vaccination clinic, I've been uniquely positioned to ensure the nursing voice is well represented in our policies and our guidance. For more than a decade, Cerner has been a proud sponsor of the ANCC Magnet Prize and Pathway Award. It's a true indication of our dedication to supporting organizations that excel in advancing patient care and industry innovation. Today, I'm honored to represent Cerner as a Senior Vice President, Chief Clinical and Patient Safety Officer in this annual celebration and recognition of nurses and the leadership role they play in healthcare innovation. Congratulations to everyone who's been honored at this event. While I look forward to connecting with many of you virtually, I sure hope we get to see each other in Atlanta in November to celebrate together. Until then, keep up the important charge of advancing patient care and safety during these challenging times. It is my true pleasure to introduce David Przalski and Caitlin Rollins from Western North Carolina VA Healthcare System. They will share with us exciting work they've been doing since winning the Pathway Award in 2019 for their initiative, Virtual Reality Immersion, expanding distraction therapy beyond the postoperative patients.
My sincere thanks to ANCC and to Cerner Corporation for your support of the Pathway Award, which is a springboard to accomplishment. I'm honored to introduce Caitlin Rollins, who first suggested adding virtual reality as an adjunct modality to distract from postoperative pain. She was only in her first year of practice, but obviously passionate, so we said yes. After great early results, she applied for the Pathway Award on behalf of the Western North Carolina VA Healthcare System to extend our VR work to other areas of the medical center. How could we say no? Caitlin epitomizes the culture of shared governance that Pathway encourages. She then engaged with the Veterans Health Administration Innovators Network to expand the use of virtual reality. She now leads the virtual reality community of practice and consults with more than 45 VA sites. Caitlin is showing nurses across the country that ideas to improve nursing practice don't require many years of experience, but rather the fresh eyes of even the newest of professional nurses. Without further ado, here to explain the project is Caitlin Rollins.
Thank you, Dave, for that introduction. I also want to thank ANCC and Cerner for recognizing the value of this project and being such wonderful supporters of innovation. Because of your encouragement and generosity, this very cool project continues to spread and grow. So to back it up a little, what is virtual reality? VR is an immersive 3D computer-generated environment an individual interacts with. Each VR setup includes all necessary hardware and clinician-developed software specific for our veterans to be non-triggering for PTSD through the use of research sounds, colors, and images. The story began with a desire to decrease postoperative complications, improve pain management, decrease opioid use, and improve the overall experience of veterans on a post-surgical ward. As a new RN, I remember giving patients multiple doses of IV and oral pain medication each shift with minimal non-pharmacological interventions available, and thinking there has to be a better way than this. Now through environments including interactive games, meditative natural spaces, virtual painting, and art museums, patients may be transported out of their hospital bed, out of the chemotherapy infusion clinic, even out of their wheelchair to a world where their negative stressors do not exist. But I don't want you to take my word for it. This picture is of the first veteran to use VR at Charles George on July 18, 2018. He's an 84-year-old orthopedic patient who at this time was post-op day 2 following a total knee replacement. He'd been having significant issues with pain control, not helped by opioids, but following a 30-minute VR session, he felt a significant reduction in pain.
The guys come around, they said they had something they'd like me to try out, and I was in serious pain, really. I don't know, it just, for some reason, the way they put it together, you're just not thinking about your pain. You're thinking about, what you're doing. And so it really helped.
Next, I'd like you to meet Ms. Rogers, a wheelchair-bound Army veteran living in our community living center with significant chronic pain. Prior to experiencing a decrease in functional ability and becoming a CLC resident, she worked as a volunteer at the local nature center. Now imagine Ms. Rogers walking through a forest, climbing rocks, wading through wildflowers, or even walking along a beach. Not only was Ms. Rogers thrilled with her experience, but so were the nurses caring for her as they watched her smile with childlike wonderment. This experience enabled Ms. Rogers to be temporarily distracted from her pain, immobility, and boredom while having a positive impact on her quality of life. Success of the multiple pilots was proven through improved pain management, decreased stress, anxiety, and boredom, and improved overall patient outcomes and patient experience. In all of these areas, we continue to see positive results for all outcome measures. The most impressive were noted in anxiety and pain management. I can tell you that standing by while an 89-year-old patient about to go have a painful procedure tells you all about his favorite music while he views paintings in our virtual museum will pull at your heartstrings and make you a little teary-eyed. The stress and anxiety scale utilized is local to our site and simplified for ease of use and patient understanding. The scores range from calm to out of control, signifying increasing stress and anxiety levels. Of the 75 patients who utilized VR for the indication of stress and anxiety, 92% felt calm following a session. I can also tell you from experience that helping a patient who just had his second amputation finally get some relief from his pain by launching virtual snowballs at targets will make you want to reach even more patients like him. More than half of our use of VR has been for patients with chronic or acute pain, and more than 62% of patients in both categories had a decrease in pain with VR. As nurses know, those changes in pain scores, even a single point, can mean the difference between more opioids or more comfort without opioids, an important part of coaching self-management of pain and an important step for our facilities in decreasing the reliance on opioids for pain management. Though this project started on only one inpatient ward, receiving the Pathway Award was the springboard to successfully expand this innovation. It is now offered in all inpatient areas, including mental health, rehab, long-term care, hospice, our oncology infusion clinic, and even during outpatient procedures. Charles George of the Western North Carolina VA healthcare system was the first VA medical center to utilize VR in this capacity. Now many more programs are underway, and I've helped to create the new VHA Extended Reality Network. This technology is part of the future of healthcare and will play a significant role in research and care delivery while providing an avenue for both alternative and adjunct therapies. For more information, please check out our article in the Nursing Management Journal. I want to thank everyone on this project team for their invaluable support over the past few years. I would not have gotten to where I am without them. I also want to thank ANCC and Cerner once again for your support and for taking myself and this project to places I have never dreamed possible.
Hello, I'm Dr. Christine Pabico, Director of ANCC's Pathway to Excellence program. Congratulations again to Caitlin Rollins and the Western North Carolina VA healthcare system. You've certainly been very busy since winning the 2019 Pathway Award. It's wonderful to see the progress you've made. And now for the 2020 Pathway Award. We're announcing the winners, and they're going to share what has happened since winning last year. Our 2020 winners are the first national retail clinic to be recognized with the Pathway Award, which means that the benefit of their unique program can be appreciated by millions all across the country. It gives me great pleasure to announce that the winner of the 2020 Pathway Award is CVS Health's Minute Clinic for their program, Virtual Collaboration for Nurses. Please welcome Dr. Angela Patterson, Chief Nurse Practitioner Officer, and Ann Poner, Director of Clinical Quality for Minute Clinic.
Thank you very much, Christine, for the kind introduction. It is a true honor that CVS Health and Minute Clinic are being recognized today with the 2020 ANCC Pathway Award.
Minute Clinic is proud to have been designated by the ANCC as a Pathway to Excellence organization in 2019, and we're honored to be here today to celebrate. Many thanks also to Cerner for sponsoring this important award.
I couldn't agree more, Ian. Through this new collaboration, we're better able to provide virtual peer-to-peer consultations for patients experiencing both common and acute chronic health conditions using high-resolution and HIPAA-compliant technology. Because of this project, our more than 3,000 Minute Clinic providers across the country will have access to a powerful collaboration tool that enables them to feel more connected to their peers, physician colleagues, other nurses, and allied healthcare teams, and helps them to provide high-quality, collaborative clinical care in real time for our patients. And because of this platform, we're able to share the talents, skills, and specialties across all members of our patient care delivery team, ultimately improving the quality experience of both our nurses and our patients. As we continue through the COVID-19 pandemic, the ability to quickly and effectively collaborate with each other and other healthcare providers on both a local and national level in real time is a critical tool in this new, more virtual world. Through this new tool, best practices can be shared, and coaching and training provided. It truly creates a virtual campus for our providers. We've had telemedicine solutions at Minute Clinic for years, but the current health crisis has underscored the importance of how virtual tools can help deliver care more efficiently and collaboratively. And we know they will be with us long after COVID-19 as well. Before turning it over to Ian to share an example, I'd like to thank ANCC for your help in advancing the need for healthcare innovation in our country. I'd also like to thank Cisco, who has been such a great partner in enabling the technology needed for the virtual collaboration tool.
Thank you, Angela. Since implementing the virtual collaboration tool in our clinics, we've seen many examples of how it's helping our advanced practice nurses, physician assistants, and other nursing staff connect with each other and with collaborating physicians to improve the patient experience. They've also been able to better connect with nurse leaders and educators, and that improves the nurse experience. As one example, we've had a Minute Clinic provider in Texas who saw a patient with a questionable skin rash and was able to quickly and efficiently share photos and videos of the rash with a collaborating physician to determine the best treatment plan, instead of having to rely solely on verbal description. From talking with our providers, we found the majority to be very receptive to the idea of using virtual technology. Knowing that they can safely share pictures and videos on a secure network provides them with peace of mind. And our patients feel confident in the care they are receiving at Minute Clinic as they get to see and speak with a collaborating physician as well. This is just one example of many that we've seen of how the new virtual collaboration tool is improving the experience and supporting our nurses in their day-to-day activities, while also supporting the health outcomes of our patients. We are excited for the future as we continue to use and evolve this tool throughout the remainder of the COVID-19 pandemic and beyond. Thank you, ANCC.
It is truly amazing to see what we've been able to accomplish with the help of our industry-leading partners. What an honor it's been to be here today, and we look forward to gathering with everyone in the future when we're able to do so.
Thank you, ANCC.
Hello, I'm Dr. Maureen Lau, and I'm proud to serve as the director of ANCC's Magnet Recognition Program. Congratulations again to CVS Minute Clinic. It's so exciting and inspiring to hear how winning the Pathway Prize has impacted your work. And now we turn to the Magnet Prize. This award is presented to a Magnet-designated organization whose project best represents exemplary achievements in patient care that result in positive outcomes. First, let's hear from the 2019 Magnet Prize winners. Their remarkable project focuses on reducing food insecurity and improving health for those living in the most impoverished areas of their community. What they have accomplished since then, especially in light of the pandemic, is nothing short of miraculous. Here to tell us what they've been doing since winning the prize, please welcome from OSF Healthcare St. Francis Medical Center, Chief Nursing Officer Dr. Jennifer Hopwood.
Thank you, Maureen. Winning the ANCC Magnet Prize in 2019 was an incredible honor for OSF Healthcare St. Francis Medical Center. We appreciate the generosity of Cerner and the impact the award monies has had on our 6-part evidence-based program aimed at improving food insecurity and addressing social determinants of health in our community. Without a doubt, the past year has proved challenging for those who are already underserved in our community and demanding for all those in healthcare. As nurses, we were determined to continue our efforts to address the health disparities that many in our community faced. The Faith Community nurses had more than 40,000 interactions with people in our community this past year. Our caravan continued to offer free care, making 4,400 referrals to providers, local agencies, and other support services, which eliminated 1,500 emergency department visits. The partnerships established in years past allowed us to quickly react to the prevalence of COVID-19 illness in our community by targeting specific education to groups of individuals with increased incidence of the virus. Restrictions on social gatherings caused many of the shelters and food pantries in our community to close. Resources available to the homeless became even scarcer when we lost access to locations to see this population. To solve for this, our Faith Community nurses partnered with other members of the care team and external agencies to provide more than 700 visits on the streets. Our Gardens of Hope expanded into 2 separate gardens and locations this past year. Close to 7 tons of fresh produce were distributed to individuals and food pantries in 2020, impacting nearly 15,000 people. The building of our greenhouse, which was delayed by COVID, began this past March. The 1,500 square foot greenhouse was made possible in part by the Magnet Prize. This will allow us the opportunity to provide fresh fruits and vegetables throughout the year, as well as a location for educational opportunities and chronic disease behavior modification programs.
COVID-19 presented challenges with educating students when schools closed last spring and the field trips were canceled. Our hope is to resume the educational sessions this spring and use the newly built pavilion to provide an outdoor location for student education for this next spring and summer. The pavilion was also partially funded by the Magnet Prize. Education of nurses was geared towards the implementation of the SMART meals and assessing for social determinants of health. We were able to screen over 1,200 chronic disease patients, of which close to 20% were found to be food insecure. Monies from Cerner allowed us to purchase SMART meals to give patients in need. The 4-serving meals cost $6 each and come with non-perishable items and recipes to promote healthy eating. Later this spring, kiosks will be installed throughout the community at local agencies and shelters as self-serve stations for underserved patients. Patients will be able to take a survey to assess for the social determinants of health and be pointed to resources that are open and available to their needs. The kiosk can also be connected to our EMR's MyChart tool for patients to schedule appointments and receive online education. Yes, this has been a challenging year, the year of the nurse. OSF St. Francis Medical Center nurses are continuing to change the landscape of healthcare by improving the lives we serve. We thank ANCC and Cerner for this recognition and financial support to continue our ministry. What an incredible honor. Thank you.
Congratulations again to OSF St. Francis Medical Center. And thank you for telling us what you've been doing since winning the 2019 Magnet Prize. Your work is so inspiring. And now for the 2020 Magnet Prize. We're announcing the winners today, and they'll be back in November to share updates on their work during our face-to-face conference in Atlanta. Our 2020 winners have created a program designed to meet the needs of children on the autism spectrum or with neurobehavioral disorders. This program provides special needs friendly care at all touch points throughout the facility, creating a safe haven for the patients and their families. It gives me great pleasure to announce that the winner of the 2020 Magnet Prize is Cohen Children's Medical Center in New Hyde Park, New York for Be Mindful.
You're simply the best. Better than all the rest. Better than anyone. Anyone I ever met. I'm stuck on your heart.
Here to tell you more about the Be Mindful program, please welcome Dr. Margaret Duffy, Chief Nursing Officer of Cohen Children's Medical Center.
Thank you, Maureen. On behalf of my colleagues at Cohen's, I am humbled and honored to accept the prestigious Magnet Prize Award for our Be Mindful program. We would like to thank Cerner and ANCC for this extraordinary honor. Many families struggle to provide medical care to their loved ones with special needs, such as those with autism spectrum disorder, attention deficit disorder, and sensory integration issues. The idea of bringing them to a health center for basic medical care, let alone to a large hospital setting for surgery or an admission, can be terrifying. In fact, as a result, many families will often avoid medical care altogether. Now, imagine entering a medical facility with your loved one who has special needs, seeing the Be Mindful yellow heart symbol and feeling a sense of calm. Upon seeing this yellow heart, you will know your loved one will receive care in a warm, sensitive manner with friendly surroundings and uniquely trained caregivers. The team at Cohen Children's Medical Center designed the Be Mindful program to provide care to this vulnerable population while in a medical setting. The Be Mindful sign, along with a pediatric neurobehavioral assessment tool, or PNAT, has changed the story for many of these children. Through the universal voice of the Be Mindful program, our success has been attributed to providing special needs friendly care at all touch points to ensure continuity of care throughout the organization. The program has shown sustainability for over 3 years, with successful spread to 15 institutions and multiple ambulatory settings within our health system. It is my honor and my privilege to accept this award on behalf of my entire team. To quote the co-creators of the Be Mindful program, Sharon Goodman and Jennifer Simonetti, if we can help one child with special needs, we will have made a difference. Well, to my team, I say, you have truly made a difference and helped thousands of children already. We are grateful for Cerner's generous award, ANCC's significant recognition, and the support of Northwell Health and our Chief Nurse Executive, Maureen White, along with Carrie Quinn, our Executive Director, and Dr. Charles Schlein, Senior Vice President of Pediatrics. We look forward to helping 1,000 more and 1,000 more until we can say that all children with special needs are provided the care they require and deserve.
Hello, I'm Dr. Debbie Hatmaker, Chief Nursing Officer of the ANA Enterprise. Congratulations again to Cohen Children's Medical Center. Now it's time to transition to the next portion of our program, the individual awards. As Rebecca said, the second week of National Nurses Month is dedicated to recognition. And we couldn't think of a better time or a better way to recognize the life-saving, critical work that individual direct care nurses do every day. The Nurse of the Year Awards are particularly special because only nurses in clinical care delivery are eligible. The National Magnet Nurse of the Year Awards recognize the outstanding contributions of clinical nurses in each of the 5 Magnet model components: transformational leadership, structural empowerment, exemplary professional practice, new knowledge innovations and improvements, and empirical outcomes. The Pathway Nurse of the Year awards are brand new, and this is the first time we've presented them. These two awards recognize the outstanding contributions and clinical expertise of one direct care nurse and one nurse leader from Pathway to Excellence organizations. Our winners have positively impacted their practice environment and demonstrated remarkable skills working collaboratively with members of the healthcare team. Thank you to our Nurse of the Year award sponsors for their ongoing support. Dr. Valerie Morrison, retired U.S. Navy captain and chair of the Commission on Pathway to Excellence, helped create these awards, and we're honored to have her announce the 2020 winners.
Thank you, Dr. Hatmaker. I'm delighted to announce a new step on the pathway to excellence. For the first time, ANCC is presenting the Pathway Nurse of the Year Awards. These awards recognize the outstanding contributions of one direct care nurse and one nurse leader from Pathway organizations globally. These awards exemplify Pathway's emphasis on supportive practice environments, including an established shared governance structure that values nurses' contributions in everyday decisions, especially those that affect their clinical practice and personal well-being. Happily, in our first year, the Commission has had many exceptional nominations to choose from. The two extraordinary nurses we acknowledge today have positively impacted the practice environment. They have demonstrated outstanding skill in working collaboratively with team members and combining clinical expertise with compassionate patient interactions. We hope this year's winners will inspire other Pathway nurses to accomplish great things in their own practice. All it takes is to live Pathway. Our first Pathway Nurse of the Year in the direct care category practices at the VA Southern Nevada Healthcare System. Dania Till is a certified gastroenterology nurse. When nominated, she was a direct care nurse in the Special Procedures Unit. In 2019, she earned both her master's degree and certification as a clinical nurse leader. In 2020, she was promoted to manager in outpatient mental health. Her determination to pursue higher education has created the foundation for her staff leadership in case management, patient advocacy, and ethical care. She was instrumental in developing the facility's shared governance education team and now chairs the team's education steering committee. She eloquently collaborates with nurse managers, nursing program coordinators, direct care nurses, and support team members. As an advocate for direct care nurses, Dania was influential in building the momentum for the journey to Pathway designation. She contributed to writing several of the elements of performance in Standard 1 for shared decision-making. As a Pathway champion, she assisted in the development of a marketing plan to visit every unit. This went a long way to ensuring that every nurse was an exemplar of the positive culture at the VA Southern Nevada Healthcare System. In recognition of her continuing outstanding work, this year, Dania was awarded the VA Secretary Award for Nursing Excellence. Here to present the award to Dania is Dr. Desiree Crawford.
Hi, I'm Dr. Desiree Crawford, the Acting Associate Director of Patient Care Services for the VA Southern Nevada Healthcare System. And it is with great pleasure that I have the opportunity to present the 2020 Nurse of the Year recognition from the American Nurses Credentialing Center to Ms. Dania Till.
Thank you so much. This is such an honor to accept this wonderful recognition. Thank you, Dr. Morrison, and also to Dr. Strawn and Dr. Crawford and to the ANCC for this wonderful recognition. Growing up in California, I always knew I would be in the medical field. The longing to be a nurse started with my grandma. I have fond memories of playing nurse with her as a young girl. I used to listen to her heart with the fake stethoscope. When I actually became a nurse, she always wanted me to push her in her wheelchair, in my scrubs. She would tell everyone she had her own private nurse, made her feel good. but deep down, it made me feel good too. The summer after high school, I went straight into college, earning my associate's degree and working as a certified nursing assistant at the same time. I knew I was not going to stop there. I furthered my education all the way up the ladder, finally reaching my personal goal with my Master's of Science and certification as a clinical nurse leader in gastroenterology. For me, Living Pathway started in 2017 as I came home from the ANCC Pathway to Excellence Conference in Dallas, Texas. What a thrill to be part of such excitement and determination. That conference motivated me to help our own team transform our culture into empowerment. This took collaboration of other leaders and mentors. It was not an easy task. Nurses did not have the foundation to succeed in the new concept of shared decision making, which is defined as a collaboration among colleagues with a similar goal in mind. As a team, we had to come up with strategies to educate our staff and provide the tools for success and shared governance. We created a staff workshop for this purpose. The trainings became a huge success and continues today to empower and motivate our nurses so that we can take full advantage of shared decision making and living pathway. As I was contributing to our facility's writing phase for the Pathway Standards document, I searched for stories that showed empowerment and making a difference at the bedside. And that created a foundation of mutual respect through collaboration with fellow nurses in different units. I am proud to work for the Veterans Administration and the empowerment VA nurses have here to make a difference to achieve pathway designation. The support of my leadership and peers have been phenomenal. Dr. Jennifer Strawn, Dr. Pius Atu, Dr. Desiree Crawford, and Mr. Gregory Clark have been my guiding light through this whole journey. All have empowered me to see what can be accomplished, even if it seems impossible or too far-fetched. I cannot thank them enough. When you feel it's impossible, keep on keeping on. You may be discouraged, but keep up the momentum. Thank you again.
Congratulations again, Dania. The recipient of the Pathway Nurse of the Year Award in the category of Nurse Leader practices at Inspira Medical Center in Mullica Hill, New Jersey. Julia Powers is the Director of Cardiovascular Services and Adult Health. In 2019, Julie moved her nursing team to a brand new state-of-the-art hospital. She facilitated the training and safety preparation of staff for the new campus, technology, and equipment. In addition to moving, Julie opened a new patient observation unit. The opening of this unit, Julie's 10th Department of Oversight, required developing new policies, workflows, and staffing plans. She also directed the opening of a command operations center, streamlining cooperation among environmental services, ground transport, case management, and bed coordination. Julie lives to identify needed change and works hard to make it happen. She champions opportunities for staff growth, development, and innovation. Then she mentors and collaborates with staff to help them take advantage of these opportunities. In a recent employee engagement survey, 93% of her extensive team said she treats her staff with respect. The direct care nurses who work within Julie's units reported that their work is meaningful and gives them a feeling of accomplishment. Here to present this award to the extremely deserving Julia Powers is Dr. Terry Spoltor.
Julia, on behalf of everyone in Inspira Health, we want to congratulate you on this award, which really recognizes your outstanding leadership throughout the years here at Inspira. Thank you again for all that you do, and congratulations.
Thank you. Thank you, Dr. Morrison, and thanks to ANCC for this award. I'm truly honored. I'd like to speak further about the upheavals caused by our recent hospital relocation and expansion. It was a time of uncertainty. We did many things to ensure a smooth transition. Utilizing the pathway standard of shared decision-making, we included our charge nurses in decisions large and small, from the types of beds purchased to the location of gloves. Our nurses trialed new equipment such as bladder scanners, and their recommendations were considered. I also implemented daily unit huddles to improve communication and provide updates. At the conclusion of every huddle, we asked about the current rumors and concerns. This way, we were able to get in front of these distractions and refocus on developing new policies, workflows, and staffing plans. We continue to use these huddles today, and our charge nurses also now serve as unit representatives on our hospital's daily safety call. During the COVID-19 crisis, the pathway standard of being an approachable leader has been even more important. Being visible provides me opportunities to be proactive and responsive and to engage in real-time shared decision-making. For example, during the peak of COVID-19, the staff on the step-down unit developed a model for PPE storage. Their model worked so well that it was adopted across our campus. Through my years of leadership, I've learned it is essential for nurses to feel their work is meaningful. As part of my leadership practice, I make it a habit to recognize staff members, not just publicly at huddles or meetings, but also personally by sending them thank you notes. I begin our department meetings by sharing stories that demonstrate the direct influence our quality initiatives have on our patients. All this adds up to fostering a respectful and healthy workplace culture. I became a nurse to make a difference in the lives of others. My advice for aspiring nurse leaders is that if you see something, say something and take appropriate action. This applies to workflows, policies, and behaviors. Being silent does not change a culture. Nursing is one of the most trusted professions, and with that comes responsibility. Encourage your teams to speak up for safety and be sure you do the same yourself. Thank you again. I am truly honored to be recognized.
Hello, I'm Dr. Jeanette Ives Erickson, Chair of the Commission on Magnet. Congratulations again to our Pathway Nurse of the Year award winners, Julia Powers and Dania Till. I'm here to tell you a bit more about the Magnet Nurse of the Year awards. Each nominee must be a clinical nurse, primarily responsible for direct patient care at a Magnet-recognized organization. Advanced practice nurses who meet this definition are also eligible. A panel of nurse peer reviews the application portfolio of each nominee and determines the list of finalists. As Dr. Hatmaker said, these awards recognize individual nurses for outstanding clinical performance in their field. These nurses are innovators and role models who spend their days making a profound difference in the lives of patients and families. Our winners serve different patient populations, work in different parts of the country, and have different certifications and experiences. But they all achieve recognition for the same reason: they want to do better for their patients. Here to present the first of our 2020 Magnet Nurse of the Year winners, please welcome Magnet Commissioner Dr. David Marshall.
Thank you, Dr. Ives Erickson. Our first award is for transformational leadership. It goes to Allison Reichold from the Ann and Robert H. Lurie Children's Hospital of Chicago. The United States alone sees tens of thousands of pediatric heart failure admissions each year. Management and therapy are limited, and conditions can be life-threatening. However, hope is on the horizon. A ventricular assist device, or VAD, can aid a failing heart, lessen symptoms, and improve quality of life, bridging a patient more successfully to heart transplantation. Allison joined the heart failure heart transplant team at Lurie Children's in 2018. She rapidly identified the need for a position that most pediatric hospitals do not have: VAD coordinator. On her own initiative, Allison developed a comprehensive VAD education program to train the entire cardiac care team on all devices and VAD patient care. She has guided more than 150 nurses, about 100 providers, and several members of the rehab teams. Allison's expertise, leadership, collaboration, and comprehensive approach has made a measurable impact. Compared to a 33% national mortality rate for pediatric VAD patients, Lurie Children's VAD team has had 100% survival and successful bridge to transplant. Here's another astounding accomplishment. Allison expanded the outpatient VAD program to include sending the very first child in Illinois to school on a durable VAD. Thanks to Allison's passion and drive, all this has happened in 3 short years. Now, if that isn't transformational leadership, I don't know what is. Here to present the 2020 Magnet Nurse of the Year Award to Allison Reichold is her Chief Nursing Officer, Dr. Brian M. Stahulak.
Thank you, Dr. Marshall and Dr. Stahulak, and thank you, ANCC, for this wonderful recognition. I'm proud to be a third-generation nurse. As a child, I spent much of my time with my grandmother, who taught me many things about life. She taught me how to sew, how to perfectly make a bed, and how to creatively navigate unique challenges through life. My grandmother was an OR nurse back in the 1940s at Church Home and Infirmary School, now part of Johns Hopkins Hospital. She would share stories of the innovative surgeries performed on the blue babies, which would eventually spark my interest in a nursing career taking care of pediatric patients with heart failure at Lurie Children's. Lurie Children's started implanting ventricular assist devices in the 1990s. While patients were surviving longer to transplant, they had significant adverse events. When I joined Lurie Children's in 2018, I felt we could expand beyond conventional thinking in order to support more patients. In 3 short years, our program has gone from implanting around 5 patients a year to supporting 7 patients at once. Not only were we caring for more patients on VADs, but we had doubled the types of VADs available. I partnered with our team to encourage an innovative approach to device and cannula selection, from the smallest of babies to our young adult population. We recently supported a toddler on device for over 6 months. While on support, she hit many milestones, including crawling and eventually walking. Historically, this same patient may have waited for a heart transplant while intubated, sedated, and on many IV medications. The rapid expansion of the service required the need to develop a comprehensive VAD education program. As the Lurie Children's VAD coordinator, I developed a training program to include VAD education days, VAD sims, and competency checklist. I'm proud to be a part of the leadership committee of the Action Learning Network. I chair the Driveline and Infection Prevention Committee. Collaborating internationally, we have reduced stroke rates for patients on device, increased the rate of VAD patients discharged home on device, and improved timeliness for congenital heart disease referrals for advanced care. I'm humbled to receive this award. It is the joy of seeing a patient learn how to walk while on support for months that continues to inspire me to push the envelope to improve the care of pediatric patients with heart failure. Above all, I've learned that a creative approach to unique challenges is essential to improving outcomes for patients and families. For that realization, I have Lurie Children's and my grandmother and mother to thank.
Hi, my name is Nan Finnis. I'm the Chief Nurse Executive at UKG, and it is an honor to be here today virtually to celebrate the Transformational Leadership Award that we are sponsoring. Nursing has a very critical role today to advance the future for healthcare, and we're proud to be able to be here to honor you. Thank you.
Congratulations again, Allison. I'm Magnet Commissioner Rick Evans, and it's an honor to be with you today. Our next Magnet Nurse of the Year for Structural Empowerment is Richard Ramos. Rich is a clinical nurse 4 on the Hematology Oncology Unit at Lucile Packard Children's Hospital in Stamford. And yet he's so much more. After serving 1 lifetime as an Army brat and then as a lieutenant in the U.S. Army, Rich has served honorably at the bedside of thousands of patients for more than 29 years. As a lifelong learner, Rich holds a master's in nursing and is a clinical nurse specialist and pediatric nurse practitioner. He is a strong leader who serves on many decision-making committees, both at Packard Children's and at the international level. On a local level, Rich co-facilitates a community support group for Latinx families with children stricken by cancer. This commitment helps provide health diversity and equity to these high-risk patients and their families. Using his bilingual, bicultural talents, he's also taught nurses during frequent volunteer trips to Central and South America. Rich has been recognized by the National Association of Pediatric Hematology Oncology Nurses with an Instructor of the Year award. This acknowledgement of his outstanding work teaching the Latinx population reflects his belief in one of Packard Children's strategic priorities, expanding outreach and providing extraordinary care in their community. His contributions to international nursing professional development, as well as community service, demonstrate his true passion and support for lifelong learning for all nurses. Here to present the 2020 Magnet Nurse of the Year Award for Structural Empowerment is Rich's CNO, Dr. Jesus Cepero.
Rich, Stanford Children's Health is so honored to have you. Congratulations.
Thank you so much. Thank you, Commissioner Evans and Dr. Jesus Cepero. I'm completely humbled and utterly grateful. Being considered for this award, let alone selected, took me by complete surprise. I guess a couple of colleagues caught me doing something right. 40 years ago, I listened as a friend spoke to my twin brother about our profession. Nursing, whispered an ever so small voice in my head. Something stirred. It occurred to me that I'd be doing that in due time. But first, I had to honor my commitment to the Army. In retrospect, the calling to military service was part of what led me to where I am today. It's all one path. It took a year just to master the mechanics of pediatric oncology nursing, then another 2 to understand the clinical fabric. Looking at the process holistically, I came to appreciate the tapestry that nurses call caring for children with cancer and their families. All the while, there was a preceptor, a mentor, an educator, and a clinical nurse specialist looking over my shoulder and guiding my hand. The nurturing didn't stop at the bedside or at the unit level. All in all, Lucille Packard Children's Hospital provided me with an outstanding structural framework to develop as a nurse. I was constantly inspired by hospital leadership to evolve intellectually and professionally. They encouraged me to apply to graduate school and bring some enhanced skills to bear as an advanced practice nurse. And I would do so, but it was more through the scope of global health. My leadership was thrilled to have me practice globally, as was I. They provided me with the means to work locally and abroad by structuring my schedule and donating myriad material resources. They helped me achieve a balance that allows me to provide care and instruction at home and in numerous countries. But I think they must have known something. Letting me do global health would enhance my skill set, benefiting both my unit and the hospital, a win-win, if you will. In closing, I would like to thank God. I'm not the most religious person in the world, but I recognize our source's hand in that which has led me here today. Thank you, Paula, my wife, for teaching me a thing or two about God. I would also like to thank Christine Taylor and Sarah Ferrari, 2 extraordinary nurse champions, for having nominated me. Most importantly, thanks to the countless teachers and mentors and families who have inspired me. They are far more gifted, selfless, and generous in all the ways that matter to nurses in our Magnet organization. And my special thanks to ANCC for this recognition.
Congratulations again, Rich. I am Magnet Commissioner Danny van Heusden, here to introduce our next Magnet Nurse of the Year. Dr. Roberta Kaplow personifies every attribute of exemplary professional practice. This fast-moving, fast-talking native New Yorker landed like a whirlwind at Atlanta's Emory University Hospital in 2009. Currently, the clinical nurse specialist in Emory's acute respiratory ICU, Dr. Kaplow creates an effective and efficient practice environment. For example, Roberta has collaborated with colleagues to create new care delivery systems and protocols aimed at improving outcomes for patients critically ill with COVID-19, while assuring clinician safety. Her recent article in Critical Care Medicine regarding care of COVID-19 patients has gained worldwide attention. Roberta has also made an international impact in guiding others to clinical excellence by authoring and co-authoring nearly 30 other publications. Roberta is a big believer in certification. Her frequently cited article, The Value of Certification, has ignited a passion in Emory's acute respiratory ICU nurses. In fact, more than 65% have achieved specialty certification. Roberta's collaborative work to establish a team of culture of safety, high reliability, and superior outcomes embodies the best of magnet nursing. Here to present Roberta with her richly deserved award is the Vice President and CNO of Emory University Hospital, Dr. Nancy Feistritzer.
Roberta, it's my honor and privilege to present to you the 2020 National Magnet Nurse of the Year Award for Exemplary Professional Practice. On behalf of Emory University Hospital and the ANCC, congratulations.
Thank you so much, Nancy. This is certainly a stunner, and thank you so much for all your kindness, support, and meaningful recognition, and to Polly as well for the beautiful nomination you guys wrote. So thank you so much, and truly working at Emory has been a dream, so thank you so much.
Richly deserved.
Thank you so much.
Congratulations.
Thank you.
Thank you, Commissioner Ben Hesden and Nancy. I'm truly honored to receive this prestigious award. As cliched as it sounds, I became a nurse to help people. I initially considered being a veterinarian. Then I thought I could maximize my contributions if my patient could actually talk to me about their health concerns. Turned out to be the best decision I ever made. I spent a good part of my career translating theory into practice. One example is the implementation of the synergy model at Emory. I became part of a system-wide team to revise orientation documents and protocols to be consistent with the model. Before coming to Emory, I was asked by AACN to write a book on the synergy model. Those of you who know me won't be surprised to learn that a colleague and I actually had the entire book outlined on a napkin by the time our taxi ride back to the hotel was over. As I accept this award today, I'm representing all the nurses at Emory University Hospital who are risking their lives daily caring for patients with COVID-19. As this pandemic continued to spread, our nurses embraced magnet principles and collaborated with hospital leaders and team members to develop innovative strategies to improve nursing workflow and preserve personal protective equipment. One immediate concern was the possibility of PPE shortages. Some hospitals have already reported that as a reality. I suggested to our nursing and interdisciplinary teams the idea of implementing a warm zone model in the ICU, and I took on the role of selling the idea internally. I'm pleased to report that the gown usage per acute care RN has decreased by 13%, and time donning and doffing PPE has decreased by 58 minutes in a 12-hour shift. Given the time and equipment savings, the ICU nurses are pleased with the decision to implement the model and its success. It's one example of how nurses at all levels collaborated to make a difference during a challenging time and how theory was translated into practice. Nancy played a pivotal role in the success of the warm zone implementation. She provided me with time to develop evidence and translate the model into practice. She also supported me to augment collaboration and solve clinical issues. Exemplary professional practice embraces what nurses can achieve. Working in Emory's magnet environment has afforded me the opportunity to help make a difference. It's a privilege to come to work every day with a team that values optimizing patient outcomes. With apologies to the veterinary profession, if I had to do my career over again, I would do the same. Thank you all.
Congratulations again, Dr. Kaplow. Our next awardee in the domain of new knowledge, innovation, and improvement certainly deserves this honor for her work in the specialty practice of wound, ostomy, and continence care. From the University of Chicago Medicine, Jan Caldwell. Her contributions have informed and influenced clinical practice for nurses and physicians, not only at the University of Chicago Medicine, but across the globe. Jan has led prominent professional nursing organizations and published widely on evidence-based clinical findings. Physicians and surgeons seek her expertise in the care of their patients with complex wound and ostomy needs. Her noteworthy contributions to creating knowledge include authoring 53 peer-reviewed articles, 8 chapters in physician surgeon textbooks, 6 chapters in general nursing textbooks, creating the stoma curriculum for the American Society of Colorectal Surgeons, and co-editing the last 4 editions of the textbook used to educate WOC nurses on ostomy care. Wow. At the most recent WOCN conference, Jan shared a new model of care developed during COVID-19 pandemic, describing how to innovatively conduct telehealth visits for ostomy patients. At a time when many clinics across the city were closed, UCM's ostomy patients used this invaluable resource to access uninterrupted expert care. I could go on and on. Suffice it to say, in this brief summary of Jan's accomplishments, that she has earned the Magnet Nurse of the Year Award for new knowledge, innovation, and improvement many times over. Here to present the award to Jan is her CNO, Dr. Emily Chase.
Thank you, Dr. Pappas, and to my CNO, Dr. Chase. My thanks to the Magnet Nurse of the Year nominating committee for awarding me this honor, and to my colleagues at the University of Chicago Medicine who have encouraged and supported my practice. I've been a nurse for quite a few years. Reflecting on my entry into practice, I remember my Aunt Kate, who ran the OB practice of 2 very busy physicians. She was a woman who loved her job and instilled the love of nursing in me. She completed her nursing education with a bachelor's degree in the 1940s, which at that time was unusual. She helped me understand that obtaining a college degree upon my entry into nursing would best serve my patients and maybe even influence the nursing profession. Thanks to my aunt's inspiration, I became an advanced practice ostomy nurse. Because of UCM's support of nursing research, I've had the opportunity to create new knowledge and improvements in the care of ostomy patients. Since almost 2/3 of patients develop peristomal skin issues, this is an area that needs our attention. I was the lead investigator as our research team developed and completed one of the only randomized controlled trial ostomy research projects, examining peristomal skin integrity, cost of care, and patient satisfaction. It is a patient-centered activity such as this that I believe we as nurses are in a prime position to lead and develop. The most important part of my practice is providing direct care to ostomy patients. Our ostomy clinic is an independent nurse-run clinic with support from the Department of Nursing and General Surgery. We have a busy outpatient practice providing care to patients who are preparing for surgery, as well as those who are learning how to return to a healthy life with an ostomy. The leadership at the University of Chicago Medicine supports all of our nursing staff to pursue excellence and has supported the development of autonomous nurse-led clinics. Much as my Aunt Kate inspired me, I hope my work inspires nurses beginning their careers to aim high. Don't think that there's already enough knowledge in our field. Even after 40 years in practice, I'm still learning and innovating. My thanks to the ostomy care team, our director, Susan Salmas, and the surgical and medical teams that work with us daily. My final thanks is to my husband, Jim, who patiently listens to a daily recap of my activities. He probably knows enough about ostomy nursing that he could take the certification test and he'd pass it.
Congratulations again, Jan. I am Commissioner Melissa Klein, and I'm here to introduce our final Magnet Nurse of the Year for empirical outcomes. From the Ohio Health Grant Medical Center in Columbus, Ohio, this is Denise Williams. As the advanced practice nurse for Ohio Health's Transition to Outpatient Care Clinic, Denise provides bridge care for patients who don't have a primary care physician to follow up with after their ED or inpatient stay. Denise's role is vital to the community because she often sees those who are uninsured or have other financial difficulties in addition to their complex medical issues. She is fluent in Spanish, which allows her to deal conversationally with many of her patients. Over the past 5 years, Denise has greatly expanded and refined the clinic's practices. Among many other examples, she created a process for referrals from the ED to the Transition to Outpatient Care Clinic. She partnered with inpatient providers to prioritize follow-up for patients with high-risk diagnoses, reducing readmissions. And here are some of the results of her work in the past year. Not one patient left the clinic without being seen. 90% of patients did not return for an ED visit within 30 days. And 93% of patients did not require inpatient readmission within 30 days. Denise also promotes patient education and self-care. She enjoys calling patients after their clinic visits to discuss their progress and understand any new issues. She ensures they have a strong understanding of their new diagnosis and treatment plan. In short, Denise is a daily inspiration to her team. To present this award, here is Ohio Health CNO, Beth Steele.
Congratulations, Denise.
Thank you. Thank you, Dr. Klein, and thank you, Beth. I will have to admit that nursing was not my first choice, but looking back, I can't imagine being in any other profession. And in a way, I think nursing actually chose me. From a young child, I thought I was going to be a pediatrician. When I started my undergraduate degree at Ohio State University, I somehow found out that I didn't need to major in a science to get into medical school. I came up with the brilliant idea that I was going to major in Spanish and still get into med school. My mother, thankfully, guided me to just look into nursing and give it a try. I negotiated with her that I would try nursing for 2 years and then figure out my next step. Well, this year marks my 26th year as a nurse. I guess moms really do know best. I don't know of any other profession that would have allowed me to grow personally and professionally as being a nurse has done for me. I still get to help people, but most importantly, I get to help people learn how to care for themselves. For most of the last 20 years, I've worked here at Grant Medical Center. The magnet culture of our organization has nurtured me to grow from bedside nurse through several layers of inpatient care to my current position as nurse practitioner in the Grant Outpatient Care Center Transition of Care Clinic. Working in the inpatient world, I thought I set my patients up for the real lives in the community. It wasn't until I transitioned to the outpatient world that I realized there was so much more that I needed to do for my patient. As a new outpatient NP, I was scared. I no longer had the security of having all the inpatient services at my fingertips. Using community resources was not familiar to me at all. Fortunately, my collaborating physicians and the clinic staff guided me to find my outpatient legs and stand on my own. Without their support, I wouldn't have been able to develop and advance into my role. Sometimes in the hospital, we forget that the patients have outside struggles that compete with their health concerns. In the TCC, I have the privilege of talking with my patients on a different level, one that takes their real world into account. I'm always humbled to hear my patients say how they were scared to have been seen by a medical provider, or that they hadn't sought medical care for many years, but they're glad that they came to the TCC. As I explain to my patients, I am here to help care for them, teach them about their diagnoses, and cheer them on as they learn to control their health, something they didn't realize they could do. And the same has been true for me. My whole career has been about doing things I didn't realize I could do. Thanks, Mom. De mi corazón a ustedes, gracias a todos. From my heart to you, thank you.
Wow, what an incredible lineup of inspiring winners. Congratulations to all of you. Thank you again to our generous sponsors. The 2021 winners for all awards will be announced at our co-located ANCC Pathway to Excellence and National Magnet Conference. It will be held in Atlanta, and it will be in person. The dates are November 11th through the 13th, with pre-conferences beginning November 9th. Registration and housing will open in June, and we can't wait to see you there. This concludes the ANCC National Awards ceremony. Thanks to all of you for joining us today.